everyone, this is my Module 4 discussion. This week we are looking at depression and anxiety and other various behavioral symptoms in the central nervous system and how the central nervous system is affected. We know that depression, no one is safe from depression or anxiety. It affects ages across the board, any race, ethnicity, gender, anyone and everyone can be affected by depression or anxiety. So for this discussion, we are looking at childhood depression, also known as pediatric depression. Some of the risk factors for pediatric depression include stressful life events, such as the loss of a parent or someone close to them. Also, illnesses in young childhood, like cancer, also puts a very young child at risk for depression. Family history. If a parent, especially a mother, is found to be suffering from depression, it puts a young child at a greater risk to also suffer from depression. It's important for us to look at the signs and symptoms for these children and diagnose these children and especially treat for depression, because if they are found to be depressive at a young age, 3, 4, 5, 6 years old, it puts them at a higher risk for suicide. Even though the suicide rates from 8 years old and below are found to be quite low, if the rates and statistics for suicide increase dramatically at age 10 to 14. So they're finding that these children that are committing suicide at such a young age were showing symptoms in the preschool, young school age as well. So if we can catch these and treat them before they suffer for so many years that leads to suicide, then we could save a lot of children's lives in the meantime. Some of the signs and symptoms for young children suffering from depression include a refusal to eat, chronic fatigue, lack of concentration, sensitivity to rejection. Most kids don't care if another kid walks away and someone else walks up. They just continue to play. But the ones that are extremely sensitive to rejection or have an ongoing sadness due to a rejection could lead to or be a symptom of depression. If they show a drastic change in the way that they're eating or they're sleeping, if their play revolves around death or dying, could be a warning sign for depression. And also, if they're continuing to complain of aches and pains, then that could be a risk factor as well. So we know that depression is due to a modification of the neural transmitters in the central nervous system and an imbalance of chemicals within the central nervous system, such as dopamine, endorphin, serotonin. If there's an significant increase or decrease of the chemicals within the central nervous system, this puts patients at a higher risk for depression, anxiety, or bipolar disease. So, generally adults can be treated right off the bat if they're suffering from major depression. We can place them on an antidepressant or serotonin MAOI or serotonin reuptake inhibitor, and even if it's just for a short while to help them kind of get over the hump. With children, treatment is a lot more limited. The first reason is because research, it's very difficult to research medications in this young age of a child. Um, Also, we're not really sure how antidepressants affect children later in life, how it affects their development, the development of emotions, or their mental development. We're not really sure how it's going to affect them later in life. So we have to be really careful in prescribing medications for such young children. So how do we treat them? Therapy is first and foremost play therapy in the very young, the 3 and 4 and 5 year olds. Play therapy is very important. Getting them outside on a very regular basis, getting the sunlight, the vitamin D, it's that phototherapy that adults are used to, but it's you know, the sunlight itself gets that vitamin D going, helps them find those feel good feelings again. If we're finding that it's one of the things that we look for the signs and symptoms is, how often is it happening? How long are they experiencing these symptoms? That helps us diagnose whether or not they're actually suffering from depression, or if they're just feeling sadness for a little while. If we're finding that they are suffering from the symptoms of depression for a long period of time, or if psychotherapy is not effective for them, then the medication of choice is the selective serotonin reuptake inhibitor. Um, it inhibits the serotonin from crossing the synapse, and it inhibits a large amount of the serotonin from crossing the synapses, and helps them find that feel good, happy feeling again. Um, and hopefully they would only have to be on it for a short period of time, and then kind of let the psychotherapy take into place, get them over that hump, and get them off of it, because as I said, we don't know how it's going to affect them later in life. So again, a really important discussion, important for nurses to be aware of, and for people in general to be on the lookout for, to make sure that all of these children are caught and treated. So I look forward to everyone else's responses. Thank you.